Good afternoon. I'm still LaRue Allen, or LaRue Allen for those who are joining us this afternoon, reconvening the session. As a reminder, this meeting is a part of an Institute of Medicine National Research Council consensus study on how the science of children's health, learning, and development can inform how we prepare a workforce to seamlessly support children from birth to age 8. You can find the full statement of task in your materials or at the posted on the project website for those of you who are on the web with us. Today's public session is being held to help the committee gather information for the study, and this afternoon you're going to have the opportunity to hear from a variety of stakeholders who were involved in work related to this study. Fortunately, there was a lot of interest in this topic and a lot of very engaged individuals and organizations. However, that means that there were far more people who wanted to be in these seats this afternoon than we could accommodate. Therefore, the speakers were selected by lottery. Those of you who were not selected are encouraged, as are you all, to write to the committee at the website that was provided earlier today and will be up there for your viewing pleasure before too long. After the stakeholders speak and after a break, we're going to have a session that looks far ahead to the release of the report. And we're going to ask all of you to think about the kinds of communications and dissemination activities that you'll be informed of the kinds of activities we typically engaged in, and then you will be asked for your ideas about the kinds of tools and processes for communication that would be useful to you and the audiences that you reach and feel would be a good fit for this study. Please remember that at this time, the committee has made no conclusions or recommendations. So any comments you hear from a committee member should not be interpreted as positions of the committee, of the member, the committee as a whole, the Institute of Medicine, or the National Research Council. The speakers have been asked to focus on the following question. From your perspective, how can children be supported to move more seamlessly through the birth through 8 continuum? Speakers, you will have up to 5 minutes, and I apologize now for being very strict about keeping to that time limit. We have a light here that will turn yellow when there's 1 minute left, and then when it turns red, guess what? We have 4 speakers who are connecting remotely. Are we ready for the first speaker? Now, I'd like for each of you to introduce yourselves and then launch into your comments. So we're going to start with Marcy. Marcy, you ready?
Yes, I'm ready.
Go.